A 44-year-old woman with persistent pelvic pain is scheduled for a pudendal nerve block under ultrasound guidance. Which of the following anatomical landmarks is most consistently used to guide needle placement for this procedure? So not a very famous block, pudendal nerve block given for perineal pain, hemorrhoidectomies, for pain relief, but most commonly it is used in the second stage of labor when you want to give an episiotomy, or later when you want to repair the episiotomy scar, you can give the pudendal nerve block. The pudendal nerve arises from your S2, S3, S4 components, and it mainly supplies the area of the perineum and the perirectal area also. Okay. So your pudendal nerve, how do you block it? So you make the patient lie down in the lithotomy position as shown over here. Then you put your finger through the per vaginum and you feel for the ischial spine. Okay, so this is your ischial spine. If you can't feel for the ischial spine, then you need to feel for a hard ligament, a thick ligament, which is nothing but the sacrospinous ligament. The sacrospinous ligament, as you understand from the name, it joins the sacrum over here to the spine, ischial spine. Okay, so this white ligament that you can see is your sacrospinous ligament. And just next to this white ligament, where this white sacrospinous ligament meets the ischial spine, that is where your pudendal nerve is going to be. Okay, so what I do is I simply put in the needle, I feel for the ischial spine, and close to where it is meeting the ischial spine, the sacrospinous ligament, I give the pudendal nerve block as shown in the picture. So if they ask you over here, what landmark is most consistently used to guide needle placement for this procedure, it will be the ischial spine. It is prominent, it is easy to palpate, and it is where you will find the pudendal nerve consistently.